Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Ahzam Afzal. He's a healthcare executive. Today's Kevin MD article is Effective Strategies to Reduce Hospital Readmissions Amidst Staffing Shortages. Ahzam, welcome to the show.
Thanks for having me, Kevin.
So let's start by sharing your story and journey.
Yeah, so a little bit of background. So I've been in this value-based care world for the last decade. Initially started out as an executive at CVS Health. I started building out a lot of medication therapy management programs, and the goal of that was really to design programs that were to help reduce readmissions, drive down total cost of care, enhance medication therapy management, and did that for a number of years, helped to really drive down the total cost of care in those specific segments. And I think consistently one of the challenges, I think, in primary care as well as in the outpatient pharmacy world is that patients just didn't have the resources or the reminders or the technology in place to ensure that they were compliant to their medications or adherent to their medications, and help build out some programs doing that. And then, since then, back in 2015, CMS actually rolled out a program called Chronic Care Management.
Mhm.
And that was a program that was designed to ensure that patients were more compliant to their medications, more adherent to their medications. But also there was a program that was designed to ensure that in between office visits, there was a system in place to check in on patients, set care goals with the patient, and ensure that they're not essentially getting hospitalized. So that was a program that was launched in 2015, and then I started one of the first chronic care management companies shortly after that. And the goal of that program was to ensure that patients were more adherent to their therapies, to their treatment plans, and grew that across 18 states, serviced around 60,000 unique lives, and later exited that venture to a firm out of New Jersey. But through that work, had an opportunity to work really closely with a number of different ACOs, other health systems, and then also work with CMS Innovation closely on a few different initiatives. And the discussion points continually was that there are specific areas in healthcare that are areas of high cost. And one of the areas that consistently came about in terms of high cost was this post-acute care segment. And the post-acute care market tends to have one of the highest areas of spend. And it's because of the fact that these are the patients that are sickest of the sick, the highest acuity patients. And there was a big need to ensure that these patients had the right follow-through of care through the care transitions from the point of hospital discharge through the entry point into these post-acute facilities that are in the SNFs. And then also when they go home for that period of 90 days post-discharge, it's a very high cost area for CMS and for the health system. Then I started a company called Puzzle Healthcare as a result of those big issues that we identified. And that was about 3 years ago, and it was really designed to tackle this readmission problem that's been in place now for almost a decade. And the goal of that program is to ensure that patients have the right care and the right support through the transitions of care. And now we've been able to be blessed enough to work with some of the largest health systems across the country, and have been able to get really, really strong readmission rate reductions with some of our biggest health system partners, OS Healthcare and Coral Health out here in Michigan. And now I think it's being able to extrapolate that more on a national scale, and that's what we're looking to do. And I'm excited to kind of talk further about how we can solve this problem together.
Sure. So let's talk more about those strategies to reduce readmissions in your Kevin MD article. So for those who didn't get a chance to read it, tell us more about it.
Yeah, so the article really came from years of this firsthand experience of observing how critical these hospital readmissions are to both these patient outcomes as well as the economics of healthcare. And for context, the hospital readmissions are costing the U.S. health system over $52 billion on an annual basis. And many of these costs are concentrated in these high risk, high cost areas like cardiology,
Mhm.
specifically in chronic disease management, as well as post-acute transitions. And the fact that nearly 15% of these nearly discharged patients are readmitted within 30 days underscores that there's a lot of systemic inefficiencies that persist in our system. And so when writing the article, I wanted to address not just the magnitude of the problem, but also the root causes, especially in the context of staffing shortages in the post-acute space. And post-acute care in particular, in the context of staffing shortages, that's one area that's pretty large. And it's a critical leverage point in value-based care models because these facilities manage some of the sickest and most complex patients, and yet they're the ones that are often the most under-resourced patient, facilities. They're understaffed and they're disconnected from the entire broader healthcare system. And as a result, there's a lot of missed opportunities for interventions. There's poorly managed care transitions, and there's preventable readmissions that occur as a result of that. And then I structured the article around three core strategies that I believe are foundational to solving this readmission problem. The first thing I think that I touched on was the data-driven care delivery. And data is the I'd say the backbone of any sort of value-based care initiative. And without having any sort of actionable insights, clinicians are really flying blind. So having these predictive analytics in place can help us identify patients that are at highest risk for readmission. Those are generally the ones with poorly controlled chronic conditions that have these multiple comorbidities or social determinants of health that make it harder for them to recover at home. But the real challenge isn't just identifying these patients, it's just intervening in a more of a real-time fashion. And at Puzzle, kind of what we've done is we've implemented a lot of these real-time monitoring tools that are tracking patient vitals in skilled nursing facilities and even at home. And these are enabling us to flag early signs of deterioration, allowing care teams to step in before a patient ends up, back in the emergency room. And when we kind of think of these core conditions like CHF, for example, there's oftentimes weight gain, increased shortness of breath, or abnormal blood pressure that's detected through some of these monitoring technologies. A simple medication adjustment is really able to ensure that we're able to prevent a readmission like that. So that's the power of that data-driven care delivery, and we're leveraging a lot of different platforms and other things that we've also seen in health systems and also in skilled nursing facilities that are, radar sensor technology and some of these other items that enable more visibility and clear visibility as to what patients are experiencing when they leave the hospital and enter into the skilled nursing facilities. And then the other piece of it is just cohesive communication across the care continuum. And this is, I think, often a place where the system breaks down. A patient may leave the hospital with a detailed care plan, but if the SNF staff, the primary care providers, and the specialists aren't on the same page, there's a lot of critical details that are going to get lost along the way. And these communication gaps are going to lead to medication errors, missed follow-up appointments, and exacerbations of their conditions, all of which are going to cause the readmissions to skyrocket. And the goal there is to ensure that there's a streamlined and a consistent centralized EHR solution that's in place between the hospital, between the SNF, and during that post-discharge window to ensure that everybody has the right information needed to interact across the board and get the right results across the board. So it's not just the technology piece; it's also just standardizing workflows. And for example, when a patient transitions to a SNF, there should be a structured protocol for, let's say, medication reconciliation or care plan handoffs and follow-up schedules. And these small steps make a huge difference in preventing those unnecessary hospitalizations. Sure. And then lastly, I think the third pillar that's there is perhaps the most important, empowering patients and caregivers. Even with the perfect care coordination that's in place, among the providers, patients are ultimately bearing much of that responsibility for their recovery. And by expecting them to manage their complex medication regimens or follow care plans without support, it's unrealistic. And in the article, I talk more about practical solutions like leveraging digital tools to send medication reminders, offering these telehealth check-ins, and providing patients with personalized care plans that are easy to understand. And for example, for patients discharged at home, we've seen a great amount of success with RPM and remote patient monitoring combined with regular telehealth follow-ups. And this combination ensures that patients don't feel abandoned once they leave a facility, and it gives providers a way to intervene proactively when something goes wrong.
So give us maybe a couple of case studies that would really chart that post-discharge course and how some of these technologies that you mentioned would really move the needle. So give us some case study, and maybe you can include my role as a primary care physician about how I would intersect with that.
Yeah, for sure. So one of the things that come to mind is initially when you see patients that are, let's say, leaving the hospital, going into a SNF, and they're getting some sort of rehab in the facility, and then they're going to that post-discharge window. And one of the big challenges that we face is, are the patients safe enough or healthy enough to, get through their ADLs and make sure that they can function and operate in a way that they can go back to their prior level of functioning before they were actually hospitalized. So for us, like what we'll do is one of the technologies that we'll deploy is a remote patient monitoring sensor that's more of like a health sensor. It's like a health tag, for example, that sticks on the articles of clothing. Typically, it's placed on the undergarments. It's machine washable. The battery lasts 12 months, and it tracks heart rate, respirations, movement, and activity levels. So now when our care management teams are, let's say, reaching out to Mrs. Smith post-discharge, we can notice that, she hasn't been out of bed in a couple of days, or we notice that her respirations are increasing, which could potentially indicate that they're could be some sort of infection risk or something that could be deteriorating. And heart rate and respiratory rate are the two most common predictors of patient deterioration. So having that information on more of a real-time basis really helps drive outcomes and really helps drive care teams to have the right level of insights to collect not just information from what the patient's telling you, but then also looking at it objectively and saying, hey, this matches exactly what we're finding on this, RPM, the vitals and the RPM panel that's there. And that really helps to proactively address a lot of these issues. But then additionally, it's you take it a step further and say, now that you have all this information, how do we ensure that the health system partners are also collaborating to ensure that patients have a place to go versus getting hospitalized? So OSF Healthcare has been a great partner of ours, and they've set up 8 high-acuity clinics that are in place that are really designed to ensure that when patients are having exacerbations that may not be, hospitalization worthy, but there could be a chance where we need to triage them and maybe manage their condition prior to in more of like say an observation stay versus a hospitalization stay or admission. Those high acuity clinics serve as a good place to refer and send patients to when those issues do occur. And then in the SNF world, when patients leave the skilled nursing facilities, once they leave the facility, if they're within that first 30-day mark post-discharge, that is a window where patients can go right back to the facility because they're still within that coverage window that's there. And facilities are typically good partners to route those patients back to in the event that happens.
So in most of these post-discharge cases, you have patients wear some type of remote monitoring device where they can transmit the data back. And then once they find that the patient may potentially be rehospitalized, you have these post-acute facilities that can, I guess, intercept them before they go to hospital to see whether they could be corrected. Is that fair to say?
Yeah, exactly. So it's that's the more the brick and mortar solution is having them go to the high acuity clinics. But at least initially it's, the triaging with the nursing team that's identifying the issues. But then also there's a telehealth component to ensure that, hey, we have, let's say, an ER physician that's, on standby that can enter into a telehealth encounter to say, hey, is this patient worthy of going to like a high acuity clinic? And the health system partners that we have will leverage a lot of their ER docs and some of their other providers to have those types of discussions with our care teams to say, yep, this is one that we, would go to the high acuity clinic versus this one's going to the hospital. So it really helps us to triage the level of care that's being provided across the board.
So tell us what kind of outcomes you have. You said that you work with several large systems in Michigan. Tell us some type of outcomes data from your technology.
Yeah, so when we first started the company, the first health system partner that we had was OSF Healthcare. And OSF Healthcare is about 17 hospitals. They're the largest health system in the state of Illinois in terms of hospital count. And when we engaged with them, they had a huge problem with readmissions, particularly as it related to patients that were leaving the hospital, going into a SNF, and then going home. And they tracked that readmission to about 29% of patients that were leaving the skilled nursing facilities that were originally coming from OSF were bouncing back to the hospital. And it was really just a matter of not having the follow through care when the patients were leaving the skilled nursing facilities. So when we came in, it took us about, I'd say about 3 or 4 months to fully get embedded in about 75 or 80 skilled nursing facilities that were all part of their post-acute discharge network. And after, engaging with them, we were able to bring after a year of the program, we were able to bring their readmissions down from 29% down to 9% 1 year. And when we initially introduced them, they lost a little over $100 million over the last 2 years in terms of readmission penalties and a lot of the costs that were there. So there was a significant amount of savings that were really coming from the reduction in total spend in the post-acute space. So that's one instance. And then Corewell Health, which is the largest health system in the state of Michigan. We're working with the Beaumont ACO out here, which manages the post-acute network of skilled nursing facilities for Corewell Health East. And they have about 50 to 60 skilled nursing facilities that they discharge their patients to. Also have opportunities, with readmissions. And when they did their analysis, and a lot of ACOs will do this analysis, and they'll look at what are our highest areas of spend across the board. And post-acute consistently across the country tends to be one of the areas where there's the highest amount of spend just because it's a sicker, high acuity population. And what we discovered through that partnership, and now that we work with them for a little over a year, their results recently came back. So they're in the top 5%, so 95th percentile
Hmm.
in the country in terms of a post-acute spend. And historically, they've done really well across the board, but that post-acute area was an area of opportunity. And by layering in programs like this, we're starting to see even ACOs as well as health systems really drive down the total cost of care in that post-acute segment.
So, any barriers or obstacles that you had in trying to expand this post-discharge technology?
I'd say recently we've had more adoption. I think the way I look at it is sometimes you think of primary care and sometimes, health systems are a little more innovative in their thought process.
Hmm.
But for some reason, skilled nursing facilities are lagging behind in that. And a lot of times, skilled nursing facility operators are kind of stuck in like more of like an archaic way of fashion of maybe doing things of how they always used to be done.
Hmm.
So I think there's a little bit of change management with skilled nursing facilities to say, hey, this is how we've done things for the last 15 or 20 years. Why should we do anything different, at this point? So that's why for us it was important to engage like a key health system partner in a large state, get the buy-in, get the results. And now, where we're at is a lot of the health systems are now looking to add these solutions to their skilled nursing facility partners. And when the skilled nursing facilities are hearing it from the health systems that essentially are their referral source, they want to ensure that their health system partners are happy at the end of the day, just because it helps with the continuum of care. And now we're starting to see that. So I think the biggest thing is change management, in this market.
We're talking to Ahzam Afzal. He's a healthcare executive. Today's Kevin MD article is Effective Strategies to Reduce Hospital Readmissions Amid Staffing Shortages. Ahzam, let's end with some take-home messages that you want to leave with the Kevin MD audience.
So I think the healthcare system today is still too often built around processes and silos rather than the patients it's meant to serve. So I think my take-home message I want to leave is that we need to fundamentally rethink how we approach the patient experience. And it starts with asking ourselves one critical question: what does the ideal healthcare journey look like from the patient's perspective? And for me, the answer is a system where every touch point, whether it's a hospital, a skilled nursing facility, or a follow-up telehealth visit, feels connected, it feels seamless, it feels personalized. And patients shouldn't feel like they're navigating a maze or falling through the cracks. Instead, they should feel supported and empowered every step of the way. And to achieve this, I think we have to move beyond simply treating episodes of care and embrace more of an approach that's truly longitudinal in nature. And that means leveraging technology not just to predict and prevent adverse outcomes, but to actively shape better patient journeys across the way. So predictive analytics, remote patient monitoring, and AI can give us the insights we need to intervene early, reduce the readmissions, and personalized care. But these tools must be paired with a commitment to the empathy and the communication and really understanding what is a patient going through.
Mm-hmm.
And when I think of this, I think of a healthcare system where a patient is discharged from the hospital. And imagine a world where they're discharged from the hospital and they're automatically connected to a care team that spans their primary care provider, their post-acute facility, and even community resources. And now this entire team is equipped with real-time data, and they proactively reach out to the patient, not just to check vitals, but to ask how they're feeling, address barriers to recovery, ensure they understand their care plan. That's the kind of transformation we're talking about, and making the patient experience proactive and not reactive. And what we're seeing is that ultimately the patient experience is about trust. And when patients feel cared for, when they know their providers are communicating, their transitions are smooth, and their concerns are heard, they're more likely to engage in their own care across the board. And because patients that are leaving the hospital are oftentimes in a very vulnerable state, and they don't have the right supports at home or the right setup at home to ensure that they fully understand their care plan. I think for us, it's making sure that we try to put the patient first, and kind of the technology and the data and everything around it. And I think that's what leads to better outcomes, and it yields better outcomes across the board for not just the health systems, not just the skilled nursing facilities, but most importantly for the patient.
Awesome. Thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thanks, Kevin.